Welcome everyone. I'm Dr. Melody Rodarte, and I'm super excited today to share one of my favorite patients with you all. Deborah has inspired me, and you've always heard me talk about wanting to inspire my patients, and I am inspired by all of you as well. I want us to live an inspired life, and that is why I created Activated Health and Wellness, because I truly believe we can activate our lives and we can live our best lives. So with that, let's get started. We're just going to have a conversation because I think it's so important for you to hear Deborah's story. So welcome, Deborah. Tell us a little bit about what why you decided to have a consultation with me, and a little bit about that first appointment.
Okay. I have an autoimmune disease called myasthenia gravis, which causes muscle weakness and fatigue. And last summer and fall, that would have been in 19, I had an MG flare, and I was on increasing doses of prednisone and was pretty much eating everything in sight. I was already extremely overweight, and I gained another 20 pounds during that time. I was being put on more medications for the myasthenia, and it also brought out all kinds of side effects. I was not in a good place. I couldn't control the cravings. I knew I needed help. I was sad. I was frustrated. I probably was bordering on being depressed, actually. I had been seeing lots of doctors. My cardiologist and the nurse practitioner at our primary physician's office both recommended you. So I made that first appointment, and it was one of the best decisions I've ever made.
How did you feel after that first appointment? Did I scare you off? How did that, because I think a lot of people are worried about that first appointment, taking that first step. So you made the first step by making the appointment. And then how did you feel after that first conversation?
Well, I was determined to make a transition to better health and really being well as I could be as a myasthenic. But I'll admit to being pretty anxious before I even got there. I didn't know what to expect, really. I was hoping that whatever program you selected or decided on for me, or we decided together, I think we did, was going to have some whole foods. I definitely knew that I wanted to be able to make food for myself. What I didn't want was more prescription drugs, because I already take a lot as it is. So those were two things that I knew up front. And you understood that completely, all of my concerns. It was like you read my mind. We developed a plan that suited me. And when I walked out of your office, I was confident that I was going to succeed.
I love hearing that. I love that because that's my goal. I want to listen to my patients. I want to meet them where they're at. And my joy comes from when someone walks through the doors and thinks, can I team up? Is she going to listen to me? Is she going to be able to put together a plan that I am in agreement with? Right?
Yeah.
And tell us, did we have to change things throughout your journey?
We did tweak things here and there. One of the things that I really had an issue with was I still was craving my favorite fatty foods. And so you gave me some strategies how to deal with that. And that was really helpful. And I was proud that I was able to kind of, stick with it. My first real challenge was the holidays, because we started at the beginning of December. So, knowing that there were going to be cookies, and we were going to Chicago. Thank goodness we made that trip. You know, all of my favorite foods from there, I could list them right off the top of my head.
I remember the conversation.
Yes. And so one of the things I remember, you kind of enforced this about being mindful, making a decision ahead of time. Like, we were going to have pizza. Go ahead and have that piece of pizza. And then think about whether you really want or need a second piece of pizza. And to this day, I think about that. We still have that treat day for pizza. Certainly nowhere near the way we had it before, but we still do. And so I always think about that when I put that first piece on my plate. Oh, I'm so sorry.
It's okay. Life happens. Life happens. So over the months, because now we've kind of moved into, there's been, think about it, from December to now, there's been a pandemic. We're still in that. How have you been able to stay successful, and where are you with the goals that we made in December and the goals that we have now?
Well, I remember hearing so many of my friends talking about whether their clothes were ever going to fit them after, we were able to get out of the house. And I was really very happy that I didn't have that issue. I never had to think about it. There were things, and there still are things, that I can't bring into the house. And potato chips is one of them. Or I really will still want to eat the whole bag. So did I lose you?
Oh, I think I can see you. Did I pop off again?
All righty. So one of the things that really helped me was that my husband is very supportive. And he complimented me and shared those lean dinners with me and ate them without complaint. He kind of chuckles when he tells people that he's been collateral damage because he's lost some weight as well. But, we didn't ever really, say, well, we simply just can't have that. If I had wanted a piece of, had a taste for chocolate cake, I had a bite of cake, or maybe 2 bites of cake. But that's it. I don't want to do that anymore. So those are the things that really helped. Your encouragement, my husband's supportive behavior, and just feeling supported all the way around.
I do. I love that. I tell a lot of my patients, it's wonderful when our household can support us, whether or not they're overweight or are dealing with things. I think explaining to them where we're at and how they can support us is always an added benefit, because it's a united front. So if he were to bring in, if his favorite thing were chips, one of the things we talked about is we put it in his section. If they're his, or, we talk about that, buying one that you don't love, or if it is one that it is a treat day and that's something that you're going to have, we decide upon how much we're going to have, and then we get rid of it, right? Mm-hmm. That's the beautiful part about this. It's not about being perfect 100% of the time. It's about being perfect about 80% of the time. I love food. I talk about it with people that my favorite thing is ice cream, and I'll allow myself at times to have a treat. We don't talk about it being a cheat, because that has a negative connotation to it. So that is what I love, is that you have been able to make those decisions on when something is important, how much you're going to have, and whether or not you actually get joy from that food still. That's so important to being successful. So tell us some of the things that you can do today that you couldn't do in December. What are some of the achievements? Because I love, love, love hearing how people are, how my patients get more of their life back. And how many medications are you on?
Oh my gosh. I still am on a lot of medications, but we have successfully made some reductions. So that's a good thing. And I'm hoping that we can continue to do that. I did see my primary care physician yesterday, and she just was beside herself with joy when she saw me. She said, "I saw you walk in and I thought, oh my goodness, I can't wait to talk to her." So, so that's worked out well. You know, one of the things that I noticed, and some of the of it is myasthenia related as well, is it's difficult. It was difficult to get off the couch, and now it's not so difficult to get off the couch. You know, you had asked me about what my goals were and my weight loss goals. I had three coming in. One was to lose 20 pounds. And I thought, if I can do that, I can stick with this and reach all my goals. The next one was another 37 pounds. And then the third goal was to be the weight that's on my driver's license. So I've accomplished the first two plus. I haven't quite gotten to that driver's license weight yet, but I'm confident that I will in the not too distant future. So I'm 69 years old. I have no aspirations of having the hourglass figure that I had when I was a young woman. But, you know, during the pandemic, I haven't seen people. Really, the only people that I've seen are my husband and my doctors and my son's family. So last week, for the very first time, I invited some friends over for a patio lunch. And, you know, we had assigned seats around the enclosed patio or out covered patio. And we ordered food from our clubhouse. And it was so nice to see people. But I have to tell you that it was a little embarrassing to see their reaction when they saw me, because they hadn't, they knew that I was in working with you, and but no one had seen me. So I guess I shouldn't be embarrassed. I was a little embarrassed, but I was proud and I was happy. And, you know, I want that feeling of well-being for the rest of my life. I'm confident I can do it.
I am too. I am too. Because you came in wanting to have more life. You didn't want to use the cane or both canes to make sure that you would not fall.
Mhm.
That weakness was so important for you to get rid of, as well as being on high dose steroids. I remember you're like, my goal is to start weaning off steroids. And I know that's a hard goal because a lot of times with autoimmune, they want to keep you on steroids and you already made your mind up. I want to come off of these steroids. And we chose whole foods that were more anti-inflammatory. And we
Mhm.
were able to put on supplements and things to help you reduce inflammation inside your body, work on your GI system to help you out. And I love it because I can't wait to start seeing you walk around, because I know that you're jumping out of the couch and out of the chair compared to before, with making sure that you weren't going to fall over, how the weakness would take over. So
Yes.
I love that. And I love that your friends saw you. And I totally love that you corrected yourself right there, because I want you to feel proud of the changes that you have done. And I think sometimes when we're successful, we want to hide it at first because we're not sure if it's going to make someone else maybe feel bad that they haven't taken care of themselves. But instead, I want us to flip it, and I want us to feel proud and think about how can we help them in their journey too? How can we inspire them to make sure that they live their best life as well? So I thank you for saying those thoughts, because it's going to really make a difference for someone else who's in your shoes as well. And it continues to inspire me to do what I have been blessed to do, be the physician, to come alongside people who want to join me and having a better life, a healthier life, one worth living for. So I just thank you through this personal experience. Is there anything that you want to leave um, at the end of this video?
Well, I think that I thought back to, you know, what position I was in November when I was trying to decide what I was going to do, but I knew I needed help. And that was a decision that came from within. You know, nobody can tell you, you can see every doctor and the doctor can say you really need to lose weight, but until it comes from within, it's not going anywhere. Um, I would suggest that if someone is in a similar position, to kind of take inventory of how you feel about that, how you feel when you look in the mirror, when you struggle to move. And I think when you're ready and determined and you have the support of family and friends, make that call. Because like for me, I really feel like you have been one of the best blessings in my life.
Thank you. I'm blessed by knowing you and being a part of your journey. So I thank you for allowing me to be a part of it. And I'm excited for the next goal too, because it's so exciting to have a few in place and kind of be able to check mark them. And so it's been a blessing for me too. So I thank you for sharing your story with us today. And I thank you for allowing me to be a part of your life.
Thanks so much, Doctor.
All right, everyone, take care.